So that's briefly about me. You can check about me later. But point really is the weekly pains Facebook Live there we are starting today. We've divided the session into three parts. One is a weekly update based on the latest research that's come out in the last week, maybe 10 days, and how it's relevant for you, what you need to know from it, okay? And then is the cases that are there. So some real cases, but tweaked. So I'll obviously not use names, but something that's relevant for you, all right? And then question and answers based on whatever is coming from live or which were asked to me in last week or so. Okay, so let's just get started. Now, in back, neck, knee, what is very common is people are unnecessarily getting MRIs done when MRIs are not needed. Okay, so now that's very interesting because there are studies that have come out about that. Okay, so I am looking for something. Okay, the very first one is that we're wasting a lot of money on things like investigations without even knowing what the cause is. If it's your back, you need to figure out. Okay, it's your knee, you need to figure out. There was a very interesting study which looked at same set of people over 3 weeks going to 10 different centers, getting MRI done, and those MRIs being reported. And what was very fascinating, those 10 MRI centers reported different things. The findings were different on the MRIs that were done at those 10 different centers. So that's very, very interesting that we specialists, in this case the radiologists, were not agreeing on the findings in the same set of people, okay, over the 3 weeks in 10 different centers. So that's very interesting for you to know, all right? So that's number one. Then there was another study about the shoulders. What happened with the shoulder study was they looked at MRIs being done in normal people as they were aging and what was actually going on with them. So when people were aging, 30, 40, 50, there were findings of maybe a tear, maybe of degenerative changes, so-called arthritis that everyone keeps talking about, all right? But most of these people were asymptomatic, they didn't have any pain, all right? What is very important is when people like me look at those MRIs, we are prescribing or we are suggesting surgeries or injections, all right? When it is a normal finding, it is a normal process of aging, okay? And you can be pain-free, you can be doing things to a very, very high level. You need to be aware of that, okay? MRI is a very sensitive investigation. It gives you things which are probably not even causing the pain. We doctors are using it as a reason to do the next, whatever surgery or the injection or something. What is very important is your history to me is very important, or should be. Then the examination is very important. What you do in life, what your plan is for the next few years, that becomes very important for us, okay? How to kind of approach a pain, if there is pain, okay? So those are the two that I had in mind, and there was one more, give me a second. I forget, there was again something about the MRI only. Give me a minute. Yeah, so shoulder pain, we've done that. And yeah, I'm not able to find what I was looking for. Actually, really random one I just picked up. One of the studies again was talking about posture, whether you should be lying on your back, your side, or your stomach when you're sleeping, and what causes back pain, what is helpful. There is no one set of things that's going to work while you're sleeping. The only thing I'll actually say about it is you need to recover well. You need to recover well. When you recover well is when you'll be be fresh in the morning. So whether it's a pain or not, it is important you sleep. I'm talking about 6 to 8 hours minimum, bare minimum 6, all right? 8 is great, 8 to 9 is amazing if you can do that, okay? And again, should it be one single posture? No, whatever feels right is right for you. Some of us like to be sleeping on our sides or on our backs. Some of us like tummy as well. Keep moving, that is far more important than anything else. Again, research rather than just me saying it, okay? So these were 3 things that I was wanting to cover in the recent week that's come, that's of a lot of interest to me. And I think for you guys as well, who have pains, it's important to know this, okay? Now in cases, what tends to happen with people is, people think about, I have a knee, I have a painful knee, can you please help me, can you treat that knee, okay? Or a back, I have a painful back with the pain going down the leg, or maybe not, maybe the neck pain, maybe the arm pain. one thing you as a patient who has that pain, or the family who has someone in the family having that pain, you need to understand it is not about the painful part. Okay, very, very important for you to understand that it is you as a human being who's suffering with that pain, and then is disturbed and disturbing the environment around. Okay, and then it leads to far more issues. And what it is like a spiral, a downward spiral. Okay, you are irritated, you have the pain, you irritate your wife or your husband or whatever, and your people around you. Now what is happening is, because of all that pressure that is around you, the pain is going to feel a lot worse. All right, so it is very important to look at the whole environment, including you. Okay, it almost seems like I'm trying to be a Baba Rajat or something, but if you look at medicine, that's what we keep talking about, at least in the first year, and then we forget. Okay, first year of MBBS or something. Okay, when I get patients, I'm trying to deal with is the patient who's suffering with pain. Same applies to you. Forget about the doctor. First, you do that to yourself. Okay, you have pain. Try to look at the triggers that could be irritating you, especially if it is a chronic pain. If it's been a couple of months or more, years or whatever, see when are you having more pain. Is it when you're driving and someone cuts you and suddenly the pain in the neck or the back becomes worse? That is very important for someone like me to know, right? Because I need to manage it. We need to look for those micro triggers. When at work, when the boss or when the people at the workplace aren't working the way, they're not meeting your expectations, is your pain getting worse then? Now that's very, very important, because again we find out a trigger, we can address it then. Okay, is a chair, when you sit for long, is that a trigger? Okay, now all these things add up. When you travel on a holiday, is your pain lesser in spite of walking more? Isn't that a very clear sign you know what's going on in life? So it is very important. Let's look at the whole of you. Okay, fair enough, the doctors will do that, but you need to start first. All right, you have to look at it very holistically yourself. All right, now that's been something very consistently. I ask a standard question to my patients. You know, they'll tell me the whole story, and then I'll turn around and say, so tell me how you're feeling, how's life? And they get very surprised when I ask this question, how's life? Okay, because that life is the one that's going to cause pain, it will be uncomfortable, all that stuff. Okay, so please, I mean, if this one case, you know, this one example sticks with you, it's very, very important. Look at the bigger picture, look at the whole you. All right, now let me see if there are any questions. So hold on. As I was saying, the idea of this Facebook Live is we'll come up with a weekly thing. There will be question and answers if you guys have. I'll answer that. Otherwise, I have a couple of them in my mind. You know, maybe I can answer that. And again, the reason of doing this is one body, one life. It is your right and it's your duty actually to know better about yourself. You do that, half the job's done. All right. Doctors aren't magicians that you expect, you know, they'll kind of, you know, fix everything for you. All right. Now let's see. So there are some messages. All right. So it's not like we have a million viewers right now, but it's okay. We'll do with that. Okay. So one of the things is rheumatoid arthritis. I was asked by a certain person a couple of days back. I think it was the dad who had rheumatoid arthritis. And you know, can exercise help, and how can I help him, and all that. Now the point with that is arthritis is like a family of diseases, if it were, and osteoarthritis is the commonest one that we have. So most people that you would hear having knee pain have osteoarthritis. Okay, most of them. The guys who are being advised to get a knee replacement, almost all of them are having osteoarthritis. With lifestyle changes, with exercises, they respond very, very well. Okay, very, very well. You had a certain gentleman recently, I think it was 5 weeks, 6 weeks back, or I think lesser than that. And 76-year-old gentleman had severe osteoarthritis. On X-rays, MRI, even walking, he could walk barely for a minute or so. And he had come and, you know, he did like 8-9 sessions of basic exercises and stuff. And after those 8-10 sessions, which we kind of did it over 20 days, 22 days or so, the pain was a lot better. If it was 10 out of 10, it was 1 out of 10 after that few sessions that happened. It responded so well. Now the magic is in not in the exercise, but about having the discipline to do it. Okay, so that's how osteoarthritis can respond if you handle it well. Rheumatoid arthritis is a little bit more trickier. You know, the response isn't as good, but the quality of life can improve. Right, so be aware of that it can help. Will it help as much as an osteoarthritis? Unlikely, very unlikely. You have to be on drugs more than something you have to be with osteoarthritis, right? So those are the two very big ones for us. So rheumatoid arthritis, please get on with exercises anyways. If exercises inflame the joint, step back, go back at it again, all right? So that's very, very important for us. Age, yeah, so this just thumbs up on Facebook Live. So what do I say to that? Thank you, thank you. Age, again, as I mentioned about this gentleman, 76 years old, comes with that severe arthritis and he responds well. You will be surprised. The human body is very, very fascinating, whatever that age be. I've had patients, I think the oldest now I've had is a 97-year-old gentleman. Muscles respond very well to exercise. They start with aging. If it's a 97-year-old gentleman, it will still, or lady, it will still respond to exercise, but slower. All right, so it's not going to be like, oh, it will not respond. Muscles are meant for that. You kind of put them under strain, you make them exercise, and actually they start responding very well. Okay, so that's the second part, like a second example, if it were, is about the aging part. Okay, there's another one. Happened, I was doing a workshop, and it was, we will be repeating it in a week or so anyways, but it's about something very, very different from what I deal with on a regular basis. It was about cancer. And this gentleman started doing the exercises that I prescribed. It was called cancer. Earlier, I used to go to the loo number 2 to like some 20, I think the number was 40 to 45 times in a day. It was a lot of agony for him to do that. And with basic exercises, it started getting better, and he was only going like 4 to 5 times after a month or so. All right. Yes, he has cancer, but the quality of life is so important. And it changed drastically having done some very basic exercises, all right? Idea is, can we make this body more fuel efficient, all right? You do that and it'll be amazing how it'll respond, okay? So as extreme, from a simple pain to as extreme as a cancer, the role of exercises is phenomenal. There's enough evidence to show that, okay? And again, pain is pain. All of us behave differently to that, okay?
3 questions.
And there are 3 questions, so let's see. Manoj says, back pain on runners, how to resolve? There is change in spine or disc or any other bony area. So Manoj, so one thing is when you're running, first is how are you running? So the biggest problem is people when they're running, they land very heavy on their heel. So when they land heavy on the heel, the pressure goes all the way to the spine, all right? Now that's a big issue. When the heel is under pressure, the spine causes a lot of tension, and that disc could be irritated, the muscles could be going into spasm and all that, okay? All I would say to runners is please slow down. Don't worry about this whole peer pressure about how many races did you run, 52 races in a year, and did you do the best time and all that. First learn how to run better, which is pretty much saying run the way you ran when you were maybe 3 years old or 4 years old, okay? Start landing softly on your feet. When you do that, there'll be lesser of pressure on the back or the knee, okay? Even if you have pain, start reducing doing speed workouts. Speed workouts contribute a lot to your knee pains and your back pains, okay? So please cut out, just shave it off, just don't do speed workouts, okay? Again, strength training becomes very important. I keep saying it all the time. If you're a runner, you love running, if running is your love, your strength training is going to be your mother-in-law, all right? You have to work on exercise plans. Again, when we catch up again on a Saturday, I'll talk more about exercise and all that. But it's very important, do your strength training, please, okay? Priyanka Agarwal Mishra, so I have chronic back pain after I had L4, L5 herniation and nerve impingement 3 years ago. It is safe for me to do squats. Priyanka, so it's like this, don't rush into it. Go one step at a time. I would say start with baby steps. If you haven't been doing exercises, if there's still pain all the time, start with doing wall squats. Start with doing, just contracting the quads and relaxing them while you're lying flat on the ground, okay, or the bed, okay. Then you can start with wall squats. You're just going up and down on the wall with pressure all on the wall, and you go up and down, okay. Over time, start doing maybe 5 squats, and you don't have to go all the way down. Maybe you only go like 120 degrees. Don't even go to 90, all right. Even if it's this much, it's totally cool. Start moving, because you've been lied to. My colleagues have lied to you when they said go rest. With a back pain, it is very important, get moving, okay? Move as much as you're comfortable, but please get moving, okay? Avni knee pain only while running, get stronger of knee. Um, so so the simple thing is, if the muscles aren't strong, it's a big issue. We need to get them working. Again, when people run, when runners run, what they're doing is they're trying to put too much effort, and they're not running as they did when they were small, when they were young kids. Young kids use their butt a lot. Adults only run with their knees and they don't use hips enough. Okay, so please, it is important, get those muscles working for you. Your core is important, your butt muscles are important. Shorten the stride. The one very, if a simple tip, shorten the stride. Okay, so the pressure on the knee will be lesser because you'll be landing on your midfoot. Okay, so again, pay attention to what I just said. Don't worry about where you land. Just shorten the stride. When you shorten the stride, you'll automatically land on the midfoot. Okay, so just try that. And Priyanka again asked about thoracic spine. I don't know what you said, Priyanka. Let me see. I can't see it anymore, whatever you said. Thoracic spine, if there's pain there, I like something like an orange squeeze. So imagine there's an orange between your shoulder blades and you're just bringing your elbows back. And imagine you're squeezing that orange between your shoulder blades and taking the juice out of it. So that's a very simple one. Again, exercise on our YouTube, and we'll share it again in this whole thing. The other one I like is Anne's alphabet. So you interlace your fingers, put them around your neck like this, have your elbows here, and you're writing big lowercase alphabets. You're making those ABCDs, make those thoracics move. Again, Priyanka, what is very important is get the thoracic moving. It is very easy. Thoracics, I mean, if I were this was the back, this is from where to where the thoracics are from. Okay, so from around here till here. Now that's where the ribs are. Under the ribs are the lungs. As a runner, you need to get those lungs moving. Okay, basically just start with taking a long breath in and breathe out. And does not matter if you use the thoracic part or the tummy part. Okay, when you're getting that moving, those ribs will move. That thoracic part will become more agile. It'll be more mobile. Okay, so the pressure, whether on the thoracic or the lower back, will be a lot better. So get started with that. Okay, and now Bhuvaneshwari Surya Narayanan. Doctor, how to deal with RA on right knee? I just said that, Bhuvaneshwari. So RA, please get on with exercises. Very, very important. Whatever you're pain free with, or your dad in this case, get on with exercises. So he's an active sports person, is now suffering from this and is rocking his walk sideways. He's 65, still active with his exercise and daily activities. Bhuvaneshwari, again, these exercises we'll discuss on Saturday, but the point really is get him to be doing like a heel raise. So basically he's standing and he's raising his heels up the ground, off the ground like that. Get those calf muscles working for him. Okay, you'll be surprised they'll be very tight and they're not moving enough. The quads around, where the thighs are, they'll be very weak as well. The glutes will be weak as well. What we'll do is on Saturday, we'll try to figure out if we can do those exercises. Get him to do those exercises. I'll send the link as well on this post where this Facebook Live is. Okay. Sonal Khetarpal, been a runner for last 10 years, started having ankle pain on right foot near the bone. Don't remember any foot twisting. Been 2 years, it's still weak. Sonal, so again, what happens is most runners, they pick it up, they have been inactive, and then they start running again, all that stuff. Now, and it doesn't matter, this whole thing about how long you've been running. It's sometimes about doing something for more duration. You're probably doing more of the wrong thing actually, okay? And you're saying last year, did physio for a month, was fine, did swimming, started running this year and it came back. So effectively what I'm suggesting is get stronger with your core, with your glute muscles, with your quads, okay? Your ankles will start behaving, start doing heel raises, start doing toe curls, all of these things we have on our nucleus program anyways. So please start doing that. Do your exercises. Do exercise. You mentioned swimming. So go to when you're in the pool, start exercising in the pool, please. Okay? And then Priyanka has another thing. Your book talks about breathing properly rather than just breathing from stomach. Can you please demonstrate? No, so it's not about is stomach breathing proper or the thoracic breathing is proper. Nothing much. Just take a long deep breath in and you're breathing out. Okay, long deep breath in. Sitting tall like a puppet. You take a long deep breath in and you just breathe out. Okay. So here and here out. Okay, I like the chest expansion. Yes, someone could be doing the abdominal and it's okay. But each time just take a long breath in, hold it for a second or two and then breathe out. Matangi, my son is lean, how to build muscles. How old is your son, ma'am? I mean, tell me that. I'll answer that after that. Then Rishabh says, I have stiffness on my right side of muscles around spine and pain radiates towards legs. Can I do squats? So we have some very basic warm-up exercises like a pelvic tilt that you should be doing before you get on with the squats. We like suggesting people to do piriformis stretch, do rotations, thoracic rotations if you could, and side bending. Just ease it up a little bit before you do your squats. Squats are great, okay? But don't worry about the numbers increasing too much too soon. So gradually build it up. Matangi says the kid is, or her son is 20 years old. So what happens is, don't worry too much about lanky. I mean, look at me, lean, right? Just the nutrition should be good, should be eating well. Concentrate more on the protein part of it. Carbohydrates, cut down on the carbs a little bit, okay? If he's having his 3 meals well, I'm very happy with it. Tell him to do strength training, okay? You just do that much for me, you will see the differences. Someone looking lean, someone looking a little obese, if it were, does not necessarily mean much about fitness, okay? Someone could be like me or thinner or slightly more obese or whatever. It's more important to me how functional they are, how much can they do. So don't worry about just the lean part of it, okay? That doesn't mean is fit or not fit. Bhuvneshwari again says, experiencing a sharp pain on my left leg, the muscle below hip on the left side, any exercise to ease it. Bhuvneshwari, very tricky for me to kind of, understand what that means. But just get working on doing things like pelvic tilt, for example. Again, we will share in this post. I'll share what I mean by warm-up exercises, okay? And sorry, battery, and the battery is low. So what we're going to do is we're going to go off right here. Okay, there are no more questions. So, or Rishabh says thank you. So thank you, sir. We'll follow your advice. Okay, guys. So what we'll be doing is we'll be catching up next Saturday as well. This coming Saturday we'll be there at 9, and we will be talking about nucleus. So idea with the nucleus is exercises that are very easy, can be done by anyone, anywhere, anytime kind of a thing. You don't need anything extra, so just get on with it. I'll just take a couple of things that have just come out. Bhuvneshwari says, what activities to be included in a 6 years old's daily routine? Ma'am, just follow whatever plan we are sharing on nucleus. I will post the link here. They will work for her or him totally. They can easily do that stuff. Friends are picking up that stuff, so don't worry about it. Anyone can do it. Matangi just says, my sister-in-law has been diagnosed with restless leg syndrome. What exercise do you suggest? And breathing is very important. Please start with that. So effectively just ask her to take long deep breaths in for a minute every hour. Just get on with it, okay? And Bhuvneshwari says we'll wait for your next live session. So next live session is going to be on Saturday at 9 a.m. All right, and there we'll be talking more about exercise. So that'll be a little bit more interactive. I'll already have some links on my page. What exercise are we talking about? And that's about it. So we will see you guys on Saturday at 9 a.m. Okay, talking about exercise, talking about nucleus. And check out our website, www.nukeleeus.com. I'll spell it out for you. Nuke as in N-U-K-E, L-E-E as in Bruce Lee, and then us, so nukeleeus.com. All right. So see you guys this Saturday at 9 a.m. Bye.